Dear professors, honorable assistants, I'm pleased to present the following presentation about nail involvement in pediatric alopecia areata. As you may already know, alopecia areata is a hair disease characterized by the sudden appearance of one or more bald patches. Nail involvement is frequent in alopecia areata. This disorder may develop in adults as well as in children. In childhood, there is often an association with atopy. Most investigators feel that alopecia areata is an autoimmune phenomenon with heterogeneous etiology. For the aim of our study is to recognize nail involvement, especially in children, and to know the different dermoscopic aspects of the nail in alopecia areata. We conducted a retrospective study over 4 years in the pediatric dermatology consultation of Ibn University Hospital of Casablanca. We included the children of alopecia areata. The diagnosis was made on the basis of anamnesis, clinical, and dermoscopic examination. We included 42 cases of alopecia in children. 18 cases had nail involvement. For the prevalence is 43%. Average age is 11 years, of female predominantly. 16 of our patients had unrecognized nail involvement. 5 cases had nail involvement concomitant with alopecia. Nail involvement was associated with moderate clinical pelagic disease in 12 cases and was part of severe periodic disease in 6 cases. Nail involvement was predominant at the hands in 16 cases. For results, we had 3 cases of trachonitia and 4 cases of thickening of the cuticle. 6 children had longitudinal stray, and 6 cases had dilatation of the distal capillaries of the nail bed, and 5 cases had thinning of the shelf, and 1 child of Down syndrome had melanosia. Nail involvement in pediatric alopecia areata is a significant clinical aspect that warrants attention. It is often underestimated and not reported by the patient and their family. Nail involvement is correlated with the severity of alopecia areata. It can precede, accompany, or follow the onset of scalp involvement, which is often diagnosed during dermoscopic examination. Our study aims to be in line with the literature in terms of dermoscopic signs of nail involvement like distal onycholysis, thinning of the nail plates, thickening of the cuticle, and dilatation of distal capillaries of the nail bed. Hence, they are the dermoscopic signs rarely reported in literature, like nail pattern, longitudinal ridges, red spots on lunula, onychorexis, and trachonitia. For the prognostic implication is the nail involvement in pediatric alopecia areata suggests a more severe or extensive alopecia areata, possible chronic or relapsing scars, and an impact on quality of life. On the conclusion, because of its prognostic value, clinical examination coupled with dermoscopy is an important step in the management of alopecia areata in children. Thank you for your attention.